I am Robert A. Kyle, a professor of medicine, laboratory medicine, and pathology at the Mayo Clinic. The title of our paper is the 50-year incidence of Waldenström's macroglobulinemia in Olmsted County from 1961 to 2010, a 50-year span. This is a very uncommon disease. A physician would expect to see one patient with Waldenström's macroglobulinemia each year if he or she lived in a city with 200,000 persons. The other important point is that the incidence of Waldenström's macroglobulinemia did not vary over the 50-year span of this study. These cases were identified in the Rochester Epidemiology Project. This is a project that recognizes all of the residents of Olmsted County. One can be certain that all persons are recognized with any particular disease using the Rochester Epidemiology Project. The relationship of this study to patients is simply that it is a very rare disease, and the majority of patients who are diagnosed with Waldenström's macroglobulinemia have never heard of the disease before. Obviously, they are very concerned to learn that it is a malignant disease, but the physician can assure them that this is one for which there is satisfactory therapy, and patients can go for a number of years with this disease. When a physician sees a patient with lymphoma, he or she should always order a serum protein electrophoresis and an immunofixation. If that patient has a monoclonal IgM protein, one must seriously consider the possibility of Waldenström's macroglobulinemia. The future directions are to continue to monitor a population for the presence of Waldenström's macroglobulinemia over the next decade. In my opinion, we have seen no increase in the incidence of Waldenström's macroglobulinemia over the last 5 decades, so I would expect the incidence of Waldenström's to remain relatively the same in the future decades. The major take-home point is for a physician who sees any type of lymphoproliferative disorder to always order a serum protein electrophoresis and immunofixation. We hope that you enjoy the article in the Mayo Clinic Proceedings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.